3.5-year-old Reuben Kirshner was diagnosed with a tumor in the bone of his upper arm last August. Because it was so close to his shoulder joint, surgeons at St. Louis Children's Hospital decided on an unusual operation, one that required a trip to Italy to complete.
Hello, are you being shy?
The past 5 months have been difficult for the Kirshner family. Last summer, Reuben, second of the family's 3 sons, began complaining of pain in his left arm. The diagnosis, a rare type of cancer called Ewing sarcoma that had spread from the arm to his lung.
You want to tap it? Good job.
Since August, Reuben's been on an intense 5-drug chemotherapy regime that will last an entire year. But orthopedic surgeons at St. Louis Children's Hospital also had to surgically remove the section of Reuben's upper arm bone that was literally broken by the tumor. At 3.5, Reuben was too small for conventional reconstructive surgery. Dr. Martin Boyer traveled to Florence to consult with a surgeon there about using Reuben's fibula, one of the 2 bones in the lower leg, to replace the bone in his upper arm.
My reaction was, wow, they're doing so much research for my son. They've really gone literally to the ends of the earth and back.
The operation was performed at Children's Hospital November 20th.
We have a cartilage-covered top of the fibula, which will serve as his joint. We have the growth area there, which will serve as the internal engine to drive growth.
The operation has been a success.
Good. Here, stand up straight.
Reuben should also have full use of his leg and arm. With the help of those around them, they're now focused on getting Reuben through the remaining 8 months of chemotherapy. Kay Quinn, News Channel 5 cover story.
When Reuben first started, each round of chemo was 6 figures. I mean, at least $100,000. I would estimate in 2.5 years of one treatment after another, one surgery after another, bone marrow transplant, radiation, everything. In the millions is an understatement. I mean, it could be in the tens of millions. RCCS provides directly financial support. We haven't had to think about medical bills at all, which has been the greatest gift to us.
We know it is a miracle, an awesome display and a powerful sight. We know this wondrous miracle can only be divine.
In my experience with RCCS, a number of patients, both old and young, who have been diagnosed with cancer have been able to get their care from the best experts in the best facilities because the lack of insurance was not a barrier.
If you do not have the appropriate insurance, you may be denied the optimal care. And if you're forced into an HMO, the providers in that HMO may not have enough expertise to be the difference between life and death.
This organization provides for them the coverage which will allow them to see the right doctor and get the right medicine and have it paid for in a painless manner.
When RCCS says we fund miracles, that we are the people out there who are helping us fund miracles.
RCCS has been there. It's been incredible.
We know it is a miracle, an awesome display and a powerful sight.